Hello. Hi, good evening. Am I audible? I'm just checking the chat. Is anybody out there? Why am I unable to see the chat? I I can't see the chats. Okay. Yeah, now I'm receiving. Hi, Anuj. Hi, Manisha. I can see many others. Okay, shall we start? How was the exam? The results are not yet out, but I'm sure it was easy because I didn't put any very tough questions except one new question. I would say new in the sense that it was an update which came this month. Apart from that, all others were very important topics for INI, which you just can't miss. So I think you might have got almost every question correct. I just want to hear from you. Hi, Karthik. How was it, yeah? How was it? Anuj, less statistics. But there were questions from statistics. What? You wanted statistics only? There were representation from all important INI topics. Um, I think we can start. Yeah, Nikshay update. Got it? Did you get it correct? Even I have posted that in Insta. So I'm sure many would have got it. If you guys are ready, we can start. After we have only 1 hour. So let's start. Good paper. Okay, good to know that. Okay. So we are going to start with this question. If you permit, I can start. Give me a simple so that I can understand that you are all set to start. 120. Ah, Ronak. Got it, 1000. Okay. So, shall we start? There will be a delay between me asking you questions and getting answers from you. Don't bother. Just post your questions. Whenever I see the questions, I will answer. Okay. Aditi, hi. Aditi Lakshmi. Okay. So, we are going to start with this. Uh, what does AB represent here? Here, the question was on AB. You may get so many other points here, name, and you have to answer them. So, what is the answer here? Here it is. Oh, I'm sorry. You're seeing the answer, right? My bad. I actually. Okay. So, the answer is lead time, right? This is lead time. Now, let's see what it does. Okay. What actually is lead time? So, you have to understand that, like I said, there are many points which you have to keep in your mind. Not just this A and B. There are many points. Any of these points they can put as A, B, C, D, E, and they will ask, what is it? Okay. So, you have to have an understanding of all this. I'll be a little fast because this will be available and you will be anyway watching it in 2x later as well. So I myself, longest time, near, no, no, I'm coming to the answer. Okay, see, this is the usual program, or I would say the pathogenesis of a disease. What happens is, once the disease starts, for some time, there will not be any signs and symptoms, right? After few days or few months, depending upon the disease, the patient will develop signs and symptoms, and then the patient will go to the hospital, get the diagnosis, and after the diagnosis they'll start the treatment and there is some outcome, right? By the way, do you guys know that this question is from the topic screening for diseases. So this is about screening test. So my question is, where exactly do you want to apply screening? The objective of your screening is to detect the disease before the symptoms develop, right? But after a point where it is possible to be detected by screening. So my question is, if this is where the symptoms develop, and if this is the point where it is first, or this is the first point where it is possible to be detected by screening, naturally, naturally, this will be the place where you are trying to target your screening, right? Okay. Now, look at this. Suppose this is the first point where it is detected to be possible to be detected by a screening. And if this is the place where the symptoms develop, and I am applying my test here. Can you see the dots? This is where I have applied test. And the patient is screened and then diagnosed to have the disease. Then naturally, see, you are detecting the disease much ahead in time compared to the usual diagnostic test, right? So the gap between the diagnosis by usual diagnostic test and your screening test is known as lead time. So this is lead time. This was your A and B. And this is nothing but the advantage that you are gaining by your screening over the usual diagnostic test, which may be sometimes months, sometimes years, depending upon, some malignancy, some NCD, it may be even years. So that will be like a lifesaver for the patient. Okay. And trust me, I've seen a lot of questions, though lead time is the one that is commonly asked. They usually give A here, B here, C here, D here, E, F, and they'll ask, what are these points? Okay, so you have to say, they'll ask, what is this F? What is this D? So such questions also you can expect. Shall I move on to the next? Moving on to the next. I hope it is clear. I've also given my WhatsApp number. I hope you have seen my WhatsApp number. If whenever you come across any doubt, guys, this is my WhatsApp number. I'm always available in WhatsApp. Okay. Moving further, where were we? Yeah, second question. Analyze the following intervention done in TB patient, and they have given sputum examination, then BCG vaccination, hemthoracotomy, and avoiding overcrowding. So arrange them according to the levels of prevention. And levels of prevention is something very, very important for the exam. Not only in INI, even in NEET, it is very, very important. What is the answer? I don't know. If I wait for the answer, will it take a lot of time? Because this is something little, I won't say confusing, because sometimes there is a chance that you may get it wrong. Okay. So happy. Okay, you're right. The answer is B. Yes. So this question is about the levels of prevention and natural history of a disease. Here we are going to discuss a lot of MCQs from this particular topic. First is natural history of a disease. The definition of natural history of a disease is the first MCQ. Natural history means, natural history. As the name indicates, it is a phenomenon by which a disease evolves over time from its first stage till the last stage in the absence of any intervention. Okay, so that is the definition. This definition itself is an MCQ, guys. This itself is an MCQ. Okay. That means if you don't do anything from outside, how a disease evolves over time from its first stage till the last stage. And the usual natural history is something like this. It starts with a community free of risk factors, a very healthy community, right? Then what is the first thing that happens? Risk factors will evolve. Then as you can see here, the man or humans are surrounded with a lot of risk factors, but no disease. Okay, that means mere presence of risk factor will not give you disease, right? After some time, what happens is pathogenesis starts, then the disease starts, then the disease will progress, and it will go for some complications and finally some outcome that depends upon which the disease is. Sometimes self-cure, sometimes death, sometimes disability. That depends upon the disease, right? This is the usual natural history. And natural history is something, guys, see, in the absence of external intervention. That means if you don't do anything from outside, how a disease evolves is what you're calling as natural history. Now, depending on the point where you intervene from outside, we have mainly 4 levels of prevention. Which are they? You have primordial, primary, secondary, tertiary. Now, what is primordial? Primordial means you are trying to prevent the emergence of risk factors in a community where it has not yet evolved. Okay, so that is primordial. Then if you failed here, what will happen? Risk factors will come up. Then man is surrounded with a lot of risk factors. And if you're trying to prevent the emergence of disease in a community with risk factors, it is primary. Okay. Suppose you fail here as well. What happened? Disease will come up. That means pathogenesis will start. Now you are left with just two more levels of prevention, which are secondary and tertiary. Both secondary and tertiary, you are applying in the pathogenesis phase. Then I have a question. What is the difference? Both after the disease starts. Then what is the difference? You know, the pathogenesis phase is again divided to two. You have early pathogenesis and late pathogenesis. Now, what do you mean by early pathogenesis? As the name indicates, early means the disease has just started. That means the patient is still in the reversible phase. If you can intervene here, you can bring the person back to normal life. This is secondary prevention. Tertiary means in the late. Late means, okay, late. That means already the patient is in the irreversible phase. Now, whatever you do, however you try, you will not be able to give a normal life to the patient. What you can do to the maximum is you can prevent further disability and you may be able to rehabilitate the patient. That's it. Okay. So this is what I said. Okay. Moving on to the rest of the MCQs from this topic. See the definition. Trust me, guys, definition is an MCQ. That means each and every cell in this table is an MCQ. Okay. Now coming to the next part, modes of intervention. See the definition, what I have said, that I have given in the table. You can refer it later. Okay. Modes of intervention is a next MCQ. If you have ever gone through previous exam question papers, you might be knowing that modes of intervention is something very, very important. That means what are the activities that you will undertake under each of these levels of prevention. So under primordial, you have, but guys, primordial means you want a community which is free of risk factors, right? If we take the example of NCD, I can't do primary in a general population. Why? Because everybody is having some risk factor, right? So I want a community which is free of all these risk factors to do primordial. So where can I get them? I may have to go to, sometimes children, small children. I have to go to maybe kindergarten or preschool, and I have to teach children, then their teachers, the parents, so that the children will never ever adopt any unhealthy lifestyle. So what you do under primordial is you are giving health education so that people will not take up any risk factors. Under primary, we have two. So here I'm putting one. When it comes to primary, two. Okay. Which are health promotion and specific protection. Health promotion means, as the name indicates, you're simply promoting your health. Like, I'm asking you to take good food, asking you to increase your physical activity, do regular exercise, so that I'm trying to prevent as many diseases as possible. Whereas specific protection means you are specifically trying to prevent one disease alone. And the most commonly asked MCQ from specific protection is, you know that, right? Vaccination. Vaccination is coming under which one? Vaccination. And they have also asked about, vitamin A. So vaccination, vitamin A, giving vitamin A, then, iron. All these are coming under specific protection. Okay. Then under secondary, we have 3. So are you able to see that? Under first one, you have 1. Under second one, you have 2. Under third one, you have 3. And third is also very, very, very important. I said you are trying to pick the disease at the earliest and bring the person back to normal life. So early diagnosis, screening, treatment, all these are coming under secondary, right? And secondary screening, very, very important. S and S. Never, ever forget this. Because, whenever this question, whether screening is coming under which among the following levels of prevention is a frequently asked question. But, on seeing screening, you have a tendency to write it as either primary or primordial. I don't know why this is happening, because you guys may be thinking, okay, screening is something that you do first. So it has to come under primary or primordial. Nay, it's not like that. So please do remember S and S. S and S. That means screening is coming under secondary. Okay. Then under tertiary, we have 2 more, which we have already discussed: disability limitation, rehabilitation. So each of this is an MCQ, and allows me to go to the next level. Which of the following take into account the mortality rate? What is the answer? Is it time? Okay. What is the answer here? I'm unable to see anything. I think the chat got stuck or something. So let me move forward. Here, the answer is NRR, right? And what is NRR? Net reproduction rate. Net reproduction rate. You might have heard about NRR and GRR, right? Net reproduction rate and gross reproduction rate. So you should know the importance between these two. We'll start with the most important ones and later we'll come to the rest of the MCQs. Okay. Usually they ask the difference between, sometimes they ask about GRR, sometimes they ask about NRR because these two are very, 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 very important questions. Very, very important questions. Okay. Now let's see what is GRR and NRR. Gross reproduction rate, net reproduction rate. The first thing that you have to keep in your mind is that in both, you are counting only the number of girl children. As you can see in this picture, you're counting only the girl children born to a couple because the number of girls is the most important thing that determines the population size. Do you agree with me? Okay, as a number of girls increase, because only ladies can or girls can, or I would say women can give birth to live babies, right? So the thing is, as the number of ladies increases or women increases, the size of the population increases. So considering this demographic fact in GRR and NRR, you are calculating only the number of girl children born. Okay. So it is number of daughters. I'm first going to tell you about GRR. Number of daughters born to a married woman. Assuming that this married woman is completing her reproductive span without dying. That means assuming no mortality. Now, what I have highlighted in red are the differences between GRR and NRR. Okay. So, in NRR and GRR, it is the number of daughters only. Okay. Whereas in NRR, easy to remember, instead of married woman, you have a term which is starting with N. See, N, N. That means in NRR, instead of married woman, you have newborn girl. And newborn, of course, newborn, especially in a developing country like India, newborn survival is less, right? We have a lot of infant mortality rate, so many things. So there, since you are counting from the newborn period, you're also assuming mortality rate. You're also subtracting the mortality rates. Okay. So in GRR, you are not considering that there is a possibility that the woman may die. Whereas in NRR, you are also considering the mortality rates. That is why this was the answer. Okay. Now, GFR, general fertility rate. It is general fertility rate. Numerator is number of live births. Denominator is women in the reproductive age group. Okay. Women in the reproductive age group. Women in reproductive age. 15 to 49. Then TFR is total fertility rate. There the MCQ is, this will give you, total means it includes not just girls, boys and girls, right? So that gives you the completed family size. That is another MCQ. Okay. So these are the MCQs from this particular topic. Moving on to the next. True about late expanding stage of demographic cycle. I think my chat is stuck kind of. Maybe the net is slow, but video is all fine. Okay. So true about late expanding phase of demographic cycle. Very, very important. What is the answer? The answer is DR is death rate declines still further and birth rate tends to fall. Now let's see why this answer. Let's talk about demographic cycle. You know what? See, every country, whether it is developed or developing, whatever, every country will have to go through certain stages in its demographic evolution, which are mainly 5 in number. Every country has to go through that. And those 5 stages together are known as demographic cycle. And let me tell you the MCQs that you can expect from this. First one, these names you have to remember as what is stage 1, what is stage 2, what is stage 3, stage 4, stage 5, the names. That is the first MCQ, which you are seeing right in front of your eyes. Okay. Next, what is happening under each of these stages in birth rate and death rate is another or the second type of question that you can expect. And your question for the exam was from the birth rate and death rate. What is actually happening and how is it fluctuating? Okay. So let's see what is actually happening. To understand what is happening to the birth rate and death rate, you should also understand on what basis are we actually describing these stages. Stage 1, stage 2, stage 3, stage 4, stage 5. Okay, we have high stationary, early expanding, late expanding, low stationary, and declining phase. Learn it. Okay. Now, I said these are described based on something. And that something is nothing but demographic gap. It is based on the demographic gap, the shape of the demographic gap. So that brings to the next question. What do you mean by demographic gap? It is the difference between birth and death when you plot both birth and death on the same graph. Don't worry, I'll show you. See, I said graph, right? So we have x-axis and y-axis. Along the y-axis, you plot birth rate and death rate. Okay. And this difference, are you seeing? This is demographic gap. This is demographic gap. So this demographic gap is also an MCQ. Okay. Now let's see. How are these stages classified? And how do you name these stages? For that, I want you to, I hope you are able to see me. See, this is your y-axis. This is your x-axis. Okay. I think you are able to see me. And this is your birth rate. This is your death rate. And this gap is the demographic gap. Okay. Now let's see what is happening. See, stage 1. I'm going to explain. I want you to patiently listen to the next 1 hour. No, not 1 hour, 1 minute. Sorry. At least for the next 1 minute, I want your complete listening because I'm going to explain all these stages. See, stage 1 was in pre-industrial era. In pre-industrial era, number of births were very high. Number of deaths were also very high. But the number of births and deaths were almost equal in number. So what is happening to the gap? It is stationary. Okay. But at a higher rate. This is high stationary. Okay. Now what is stage 2? Stage 2 was in pre-industrial era. In pre-industrial era, what happened? New medicines were discovered. People started accessing hospitals or accessing health service. Environment and sanitation improved. Number of communicable diseases like cholera, typhoid, all these started coming down. As a result of which, what happened? The death rate started coming down. See, it was like this in stage 1. Now see what is happening. The death rate is coming down. So what is happening with the gap? It is expanding. This is early expanding. Okay. Then you have stage 3. Stage 3 was in industrial era. In industrial era, what happened? Family planning was introduced. So people started using contraceptives. As a result of which, as you can guess, what is happening? The birth rate also starts coming down with further dip in death rate. So this is late, but still expanding. Okay, the latest stage of expansion. Then what is stage 4? Stage 4 was in post-industrial era. In post-industrial era, the number of births were less. Number of deaths were also less. But the number of births and deaths were almost equal in number. So what is happening to the gap? Stationary, but at a lower rate. That is why you call it as low stationary. Okay. Now, what is happening next? Definitely, you can't bring number of deaths beyond a limit, right? Of course, everybody will die. So the thing is, you cannot decrease the number of deaths beyond a particular limit. But that is not the case with number of births. You can bring any decrease in number of births and you can even take it up till 0. 0 death, never possible. 0 birth, of course, possible, right? So this is what is happening in declining phase. In declining phase, the number of deaths going as such without any dip, you can't dip it anymore. Okay. Whereas number of births going below the number of deaths. So what is happening? more people are dying than being born. So naturally, there will be decline in population. This is known as stage 5 or declining. And I have a better picture. Oh my God, even this got stuck. No, you're seeing, right? This is what I said. Okay. And you can take a picture or whatever of this when you are watching it once again, because this has a lot of MCQs. Or just remember what I said. That will help you to answer all the questions. That is why the answer was C. Okay. I'm not going to the question once again. I hope you're with me. Moving further, a woman develops edema, visual disturbance, and heart failure after consuming a food item, which is the most likely adulteration. Is the most likely adulteration? Now I think I can see some questions. Some. Okay. Okay. Which one? The answer is, are you seeing? Still, you're not there. Oh, yes. Yes. Now I can see. Now I can see. You're right. It is sanguinary. It is sanguinary. You're right. All good. All good. So, what is your diagnosis? What is your diagnosis in this patient? Edema. Edema means bilateral pedal edema, visual disturbance because of glaucoma, heart failure, diarrhea. All these you see in food adulteration due to sanguinary. And what do you call this condition as? May I know? Correct, Anuj. Correct. This is epidemic dropsy. You're right. So this is epidemic dropsy. In epidemic dropsy, do you remember? I have given you a tip to remember. I said drops are caused by, drop, boon, are caused by two things. Do you still remember that mnemonic? Not mnemonic, it's a tip. Drops are caused by oils and water, right? So this will help you to answer. If you know this, that will help you to answer all the MCQs in this. Okay. So this is caused by an oil. Which oil? Argemone oil, which has got sanguinary in it, right? And so oil is the causative agent. Water is the clinical features. That will tell you about the clinical features, right? So all the clinical features are like water retention or something to do with water, like pedal edema. Patient will have bilateral pedal edema. Then glaucoma, cardiac failure, diarrhea. So everything has something to do with water retention or water, right? So that way you can remember. So argemone oil, sanguinary, and clinical features we have already discussed. This is bilateral pedal edema. Okay. Similarly, they will also ask about endemic ascites. Ascites is because of an alkaloid, pyrrolizidine alkaloid. Okay. So here I said, you remember ascites caused by alkaloid. And the name of that alkaloid is pyrrolizidine. And then you have, what is your diagnosis? You're seeing one stick, two stick. This is neurolathyrism. And it is caused by BOAA, BOA, beta oxalate aminoalanine, right? And then you have ergotism. Ergotism is caused by Claviceps purpura fungus, and it is a field fungus. Can you see? Even otherwise, I have another picture. See, this is a field fungus. Okay. And it is also known as Saint Anthony's fire, because it is ergotamine that is coming out in ergotism. So that will cause vasoconstrictions, and the patient will have severe burning sensation all over the body. And during olden days, they were taken to the Saint Anthony's Church, and there they got some remedy. So they call the condition as Saint Anthony's fire. Okay. Moving further to the next question. Emaciation in a child is assessed by which of the following measures? You're right, Anuj. Kesari dal. It's caused by kesari dal. Burning sensation. Yes, Aditi. You guys are good. Emaciation. What is emaciation? There is a name for emaciation. Emaciation means, very wasted. Wasted look. So you also call it as wasted or wasting. Okay, let me write it as wasting. Where do you see wasting? Wasting happens if you don't eat food for few days. So what is it? It is acute malnutrition. It is acute malnutrition. This is what is happening if you are into dieting, right? If you are into strict dieting, definitely you will lose your weight. Whereas your height will be all right, right? So what is it? Low weight for height. Are you able to see that in your mind? Your height is all right. That is not going to get affected, whereas your weight will decrease and you look so thin. That is what you call as wasting or emaciation. Sometimes the question will be wasting in a child. Wasting or emaciation is because of acute or acute malnutrition. All these you can get as a question. And in all this, what is happening? Weight for height is affected. It is weight for height that is getting affected. Okay. Whereas height for age, when is the height affected? When it is chronic malnutrition. When it is chronic malnutrition. Height is also affected. That means if the child had not had food, even from childhood, naturally that will also affect the height, right? No doubt about it. So this is also known as stunting. So stunting is seen in whatever I write here is an MCQ because I'm only writing MCQs. Shall we move further? Mr. X had undergone amputation and he's unable to walk. His condition is known as. What did you write? Mr. X had undergone amputation and he's unable to walk. This is kind of tricky because you have two different answers given, but the answer depends upon what is said last. It's not just amputation, he's unable to walk. So it has gone up to disability, right? Oh, Gajendra, did you write A? Okay, A is there, but A has led to B. Is it not? Anuj, you wrote D. Don't worry, we'll see what it is. So these three terms, disease, impairment, disability, handicap, are important. To consolidate all the MCQs which you can get from these four terms, including their example, then their definition, I have a table. I've given this table in Insta, in Facebook and all. Anyway, this is the table. Now, what is disease? Just give me 1 minute of your patient listening and I will explain the definition as well as example. This means, dis means a negative effect. So it is a negative effect of illness. As the name indicates, disease means it is a disorder which is affecting somebody's illness. Okay, that means some disease. For example, diabetes, polio. Now, disease can lead to impairment. By the way, what do you mean by impairment? No need to mug up. Just the term itself is enough. You will get the answer. Impaired is something that we normally use in our conversation. Impaired means you are losing, right? Losing what? Either an anatomical structure, as in the case of diabetes mellitus. The patient is losing leg, amputation. Or the patient is losing a physiological function, as in the case of polio. What is happening? Limb is there, but the patient is unable to use it. That is paralysis. Okay. Now, impairment can in turn lead to disability. Disability means, as the name indicates, inability to do a routine function which is normal for a person's age and sex. Because of this impairment, patient is unable to walk, which is normal, right? Now, disability can in turn lead to handicap. Are you seeing the chronological order from where you are starting and where you are ending? It can lead to handicap. Now, what is handicap? Handicap means it has some extra dimension. Because of this disability, the patient is unable to do a social role, which is expected out of him. Suppose this person is the only breadwinner of the family. He should be able to go out and do job, which he is unable to do. So, unable to work, losing one's job, all these are coming under handicap. So, I hope the answer is clear to you. It is disability because the patient is unable to walk. Okay, moving further. HDI, Human Developmental Index, is measured using all except. What is the answer? All except? Definitely is life expectancy. Is it A or B? Okay, Anuj, thank you. Got it. Okay. It's just so simple. There is no point in expecting answer from you because definitely you will give me the correct answer. So the answer is life expectancy at 1. One is HDI, Human Developmental Index. What is an next MCQ that you can expect? PQLI. So these are two favorite MCQs. This time I haven't put any tough questions. Okay, all questions are very simple only. And these are the prototype questions that you have to learn. Without this, don't go for the exam. That is my point. So PQLI, HDI. PQLI, Physical Quality of Life Index, HDI, Human Development Index. These are index, right? By the way, what do you mean by index? This is an amalgamation or you are combining few indicators. There are mainly 3 indicators under each of this. Now, let's see what is PQLI. Physical Quality of Life Index means, as the name indicates, you are trying to assess the quality of life of people residing in a country. And if you want to assess the quality of life of people in a country, the 3 important indicators or 3 important factors that determine the quality of life are infant mortality rate of that country, literacy rate of that country, right? Then life expectancy at 1 year. And HDI means Human Developmental Index. For development, most development of a nation mainly depends upon the income, right? So there it is, income, knowledge, and life expectancy at 1 year. And I have already given a mnemonic there to, for you to understand or for you to recall these indicators. PQLI is ill. Are you able to see that? Ill, ILL. Ill, whereas HDI is kill. Ill is IMR, literacy rate, life expectancy. Kill is knowledge, income, life expectancy. Okay. Now the question was between these two. Rest everything is fine. Okay. There is no confusion. But life here, it is life expectancy 1 year. Here it is life expectancy at birth. Now how to remember? Guys, in PQLI, it is IMR. IMR means 0 to 1 year. Right. So the number of deaths or the life expectancy till 1 year is already covered under PQLI. So there you start counting from life expectancy from next year onwards. Whereas I in HDI is income, right? So there you have to count from birth onwards. Is it clear? Okay. I hope it is clear. Or else, I don't know whether this mnemonic will work. I'll try to give you one more mnemonic to remember that PQLI, in PQLI, it is 1 year. Okay. I don't know whether this will work. See, I said it is ill, right? So how do you write L? The small letter L is written like, this is I. Small letter L is also written like this, right? So I'm going to write it as, this is also small L. Small L. So this is actually I, L, L. So all these are looking like 1. So 1. Okay. If it's working, again, well and good. Is it clear? So this is the concept. I have explained the concept why it is starting from 1 year, and also easy tip to remember that under E is coming 1 year. And the range, see, 0 to 100, 0 to 1. How to remember? The one which is lengthier has got a lengthier range. Okay, lengthier is PQLI. So in that, you have 0 to 100. Shorter one is HDI, in that 0 to 1. Okay, moving further. A man presents with, am I audible properly? Am I audible properly? Can you hear me properly? Because it's showing in my system that audio is breaking. Is it actually breaking? Good. Oh, okay. So you guys are saying about okay, clear. Okay. So moving further. Moving further, are we approaching the time? Yeah, epidemic typhus. Correct, correct, correct. A man presents with fever and chill 2 weeks after. Guys, this is the catch. Okay, not catch, I would say the point which will help you to answer. Okay, it's a louse bite. The patient is louse bite means it has to be a rickettsial fever. right? Some rickettsial fever, chills, maculopapular rash, almost everything will be having maculopapular rash. Louse bite is caused by, it causes epidemic typhus, right? Epidemic typhus. You're right. And this is the table which I have explained earlier. Anyway, this table will be there. We have typhus group, spotted fever group, and others, and all these things. The causative agent, everything is there. But what is more important is louse, flea, tick, mite. Don't worry. Of that, the important ones I will help you to remember using a mnemonic. Guys, remember, let. Let means louse. Starting with L, right? So, louse bite causes, this is a question, epidemic, typhus, and trench fever. Let. English word. Then you have term. Term means starting with T. So, what T? T is tick. Causes ERM. That is ehrlichiosis, Rocky Mountain spotted fever, Mediterranean fever. Then you have SPM. That is your PSM, community medicine, my community medicine, SPM. So remember, now what is left? Mite. Mite can cause pox and scrub. Okay, of which the most commonly asked ones are, as you all know, epidemic, trench, scrub. These are the ones that you usually get. And for scrub, scrub is very commonly asked question. And you will see something like this. Sometimes you will get it as an image-based question and the question will be, what is the diagnosis? Sometimes you will be given the name of this and the question will be, what is the diagnosis? What is the name of this? This is Eshkar, right? Eshkar. It's a black lesion that you see following mite bite, right? Okay. Moving further. The physical examination records of the entire incoming freshman class of 1990 at Harvard University were examined in 2025 to see if their recorded weight and height at the time of admission was related to their chance of developing CHT. I want to hear from you guys. What is it? What is the answer? What is the answer? What did you write? I'm waiting because this is a little bit confusing question. D, retrospective cohort. Okay, let me hear from others. Anuj is saying D. Oh, there are two Anuj. Just now I realized that. Okay, all Anuj are for D. A or D? That's foul. Foul play. Okay. A. No, don't worry. The answer is D, retrospective cohort. Okay. Okay. So first, let me tell you what is cohort and what is a case control, because you always have a confusion, right? So case control and cohort are analytical study designs. What you need to understand is in case control, you are starting with cases and controls. That means you are starting with, look at this, guys, you are starting with disease, non-diseased. You have a group of cancer patients. Okay, let it be CLR and smoking. So you start with case means a group of lung cancer patients. Controls means a group without lung cancer. Then you are asking them about their history of smoking. Okay, how many of you smoke? Have you ever smoked? That question you will ask to each and every person in your cases and controls, and you will find out the percentage of smokers in your cases and percentage of smokers in your controls, and the difference in the exposure between your cases and controls is what you're comparing in a case control. Whereas in a cohort, guys, though I'm explaining it using this particular picture, this picture itself is an image-based question. Identify the study design. Like that, you can get a question. So with the image, I'm explaining. So in cohort, you're starting just the opposite direction. That means you're starting with smokers. That means you're starting with exposed. You see, what I want to tell you is in case control and cohort, you have only two ends. In one end, you have the exposure group, And in the other end, you have the controls or not control, I mean diseased and exposure. You have disease and exposure, or outcome and exposure. So I said in case control, you are starting with disease, non-disease. Whereas in cohort, you are starting with exposed and non-exposed. Okay, so you start a group, take a group of smokers, a group of non-smokers. Make sure that nobody has the outcome when you start the study. Then you follow them for a particular period of time, maybe 10 years. And then at the end of 10 years, you see what percentage of your smokers have developed CA lung and what percentage of your non-smokers have developed carcinoma lung. And this difference in the outcome, can you see, is what you're comparing in a cohort. So the basic difference between cases and case control and cohort is nothing but the direction in which you start the study. In case control, you're starting with disease, non-diseased. In cohort, you're starting with exposed, non-exposed. Are you with me? And you will also get certain tips like, follow up. If you see follow up or prospective, it will be cohort. Whereas if you see taking history or retrospective, most often it will be a case control study. Now, moving further. We have mainly two types of cohort study. You have prospective cohort and one is prospective cohort. That is a classical type that I have explained right now. And the second is known as retrospective cohort. Now, what is retrospective cohort? Just like any other cohort, I said cohort means you always start with exposed, non-exposed, right? So here also you are starting with exposed and non-exposed. Then why is it known as retrospective? It is known as retrospective because you are selecting these exposed and non-exposed from the past or from the history. Is it clear? Now, let's see this particular question. Using this, let me explain. So they are doing the study in the year 2025. By the way, this study is to know the relationship between, let me see, BMI and coronary heart disease. And they are doing the study in the year 2025. And in 2025, many have developed the outcome. And they are selecting the data regarding their BMI from 1990 using the data or the records which were kept in 1990 from the Harvard University. So when they joined Harvard University, their weight and height were measured. So that is there in the record. Using those records, they are actually dividing the people or, the students back then into obese, non-obese. So they are selecting these obese and non-obese from 1990. So it is retrospective, but it is cohort because you are starting with the exposed and non-exposed. Hope it is clear. And from 1990, they are being followed till 2025 to know what percentage of obese have developed coronary heart disease and what percentage of the non-obese have developed coronary heart disease. So this is retrospective cohort study. Okay. Okay. Now, what is cross-sectional? Okay, cross-section means at one point you are doing a survey. That is cross-section. So in cross-section, most often you will see this term survey. Okay, and sometimes you will also see something known as prevalence because it's a prevalence study. That means when you do a survey, suppose I want to know the number of coronary heart disease patients today in my nearby village. I'll go to that village. I'll do a survey in that village. Suppose out of 1,000, I found that 2 are having disease. Then it is 2 per 1,000. That is prevalence, right? So cross-section study is one-time examination using a survey. If you see survey, if you see prevalence, it is a cross-section study. Okay. And what is the outcome measure in a case control? It is odds ratio, right? Whereas in a cohort, it could be PAIR. Now, what is PAIR? That is the mnemonic which will help you to remember the outcomes in a cohort study. Now, what is it? You have incidence, relative risk, attributable risk, population attributable risk. So you have incidence is I. I'm just telling that in the order. Okay. This is incidence. Then R is relative risk. A is attributable risk and P is population attributable risk. So pair is the outcome measure in cohort. So that finishes all the MCQs from these three study designs, all the important MCQs, I would say. Yes, yes, it's a snapshot study. You're right. Scavenger. Oh my God. I don't feel like calling you a scavenger, but you have named yourself a scavenger. So I'm left with no option but to call you a scavenger. Anyway, and where are we? Okay, moving on to the next question. Per protocol analysis is done in. What is it? What is your answer? Per protocol. What did you write? Dropouts are included, dropouts are excluded, dropouts are not relevant, dropouts will be considered. Quick, quick, quick. What is the answer? Dropouts are excluded. Dropouts are excluded. By the way, this question is from RCT. Okay. B, correct, correct. And dropouts are included in, if dropouts are included, see in RCT we do two types of analysis. One is per protocol analysis and the other is intention to treat analysis. I'm sure you might be familiar with intention to treat analysis. Intention to treat analysis. Here, dropouts are included in RCT. Whereas in per protocol analysis, dropouts are excluded. Okay, here the answer is dropouts are excluded. Are you with me? And I hope you know what an RCT is. RCT is randomized controlled trial, where you're taking a group of patients, you're dividing them in two arms. One arm is known as a treatment arm, other arm is known as a control arm. To the treatment arm, you give your new drug. And to control arm, you either give placebo or sometimes, some other standard regimen. Then you follow them to see what percentage got cured because of your drug and what percentage got cured because of your old drug or placebo. And this difference in the cure rate is what you are comparing in a RCT. Okay. And in RCT, when you do randomization, it is taking out two different bias. Just the names are important. Which are those two bias? It will remove selection bias and it will also remove confounder bias. So I'm just giving the MCQs. If you want to know in detail, that will be there in the app, in the recorded section. Okay. And one more study design is there where you're combining study 1, study 2, study 3, study 4. That means you are taking various studies, you are combining. What is the study design? This is again an image-based question that you can get, which is, have you heard about this? Meta-analysis. Okay, so that finishes all the study designs. And the result of meta-analysis is given in the form of what you are seeing here. I'm not going to explain it due to lack of time. The name of that is forest plot. So forest plot is what you see in meta-analysis. Moving further, 1-year-old phase 3 RCT. Yes, Anuj, phase 3 is RCT. You're right. What is it? We are in 12th question. 1-year-old child's mother come to your immunization clinic telling that the child received first dose of pentavalent at 6 weeks only. What is your plan? What is your plan? That means the child is coming after 1 year. And they are saying that 6th week immunization the child has taken. Now, what to do? Before that, or to answer this and answer many such questions, twisted questions, direct questions. This is actually a twisted question, not the direct question. I'll tell you the catch. This vaccination schedule, you have to keep in your mind. Okay, I'm not going to go through this vaccination schedule. I have posted this in Insta. I have posted this in many, many places. And I have taken classes also many places. So I'm not going to tell you what it is. what I want to tell you is, the vaccines that you're giving by 1 year, of which the most important ones, pentavalent, rotavirus, IPV, PC. These can be given only up till 1 year. That means if an unimmunized child is coming after 1 year, you cannot start the patient with, sorry, not the patient, the baby. I shouldn't be saying patient. You should not start the baby with penta, rota, IPV, or PCV. Instead of penta, you have to give DPT. Instead of penta, after 1 year, it is DPT. So if the question is like an unimmunized child is coming to you at maybe 1.5 years or at, 15 months, something like that. And if in the option, any of this is given, don't go for it. Instead, choose the option that has got DPT. And the other vaccines like JE, MR, all those you can give. Okay, no problem. That is the answer. But here there is a catch. Having said all this, I said these should not be started after 1 year. But I said started. So the catch is, if the child has already taken any of this before 1 year, forgot to take the subsequent doses, and coming after 1 year for missed doses, then it is said that you can continue the vaccination. I said you cannot start after 1 year, but already taken, forgot to take the rest, continue. So the answer here would be give the second dose of penta, because the child has already taken at 6 weeks. It's not a starting dose after 1 year. Even if it is past 1 year, you can continue DPT. Okay, moving further. I can see that all of you have given correct answer. The wrong answers were only in few, like retrospective cohort. There you got something wrong. Rest everything, I think, is fine. Holly leaf appearance of lungs on chest X-ray is characteristics of. I've discussed this in class. It is in. Shall I give you the answer? It is in asbestos. It is in asbestosis. Okay. Now, what is holly leaf appearance? See, in asbestosis, there will be pleural plaques, right? And these, can you see these pleural plaques that you see in the asbestosis is what is known as holly leaf. It looks like holly leaf, right? By the way, have you seen holly leaf? Don't worry, I'll show you holly leaf. See, this is holly leaf. HOLLY, holly leaf. Okay. Now you will be able to relate. Are you able to relate now? So this is holly leaf, which you see in asbestosis. Okay, this is in asbestosis. There's one more thing that you see in asbestosis, which you will see in so many other conditions. But just in case you are getting a question, another, appearance, chest X-ray appearance that you see in so many other conditions as well is ground glass appearance, right? Ground glass appearance that you see in asbestos as well. Okay, but something pathognomonic is holly leaf. And moving back to silicosis. Do you remember in class I have told you in silicosis you see a appearance which starts with S, S and S. What is it? Snow, storm, appearance. So S, S. Okay, so these are the commonly asked MCQs. Moving further, urine baths and catheters. Disposal in India is by, don't you remember? The mnemonic, not mnemonic, the way to remember it. I told you urine bag and blood bag go to opposite colored bins. Right? Opposite colored bins. Urine color is yellow. Blood color is red. But they go to opposite colored bags. Don't you remember? So urine bag will go to red and blood bag will go to yellow. So here the answer is red. Okay. Now look at this. Oh, did you write yellow? Manisha, that's what. Ah, Manisha, your eggshell classification, eggshell is correct. Eggshell. That's not very commonly asked. Since she has pointed it out, let me tell you one more thing. So, along with snowstorm is the one that you usually get. In silicosis, you will also find eggshell, eggshell calcification. It is the peripheral calcification of thoracic lymph nodes. Usually that will be bilateral. Okay. Okay, Manisha, since you have mentioned that, I thought I will include that as well. Guys, this is the table that you have to keep in your mind. In yellow, I don't know whether we have time. Anyway, in yellow, you are putting okay. In yellow, you are putting non-recyclable contaminated waste, right? Non-recyclable means things which you don't want to use at all. All those dirty things. Yellow, yellow, dirty fellow. I always ask you to remember this yellow, yellow, dirty fellow. All those dirty things which you just burn, you put in yellow. Okay, like anatomy waste, oil waste, all those things, including blood bag. Blood bag also you are burning. In red, it is recyclable waste. R and R. Recyclable waste. And what is that mnemonic? RPT, repeat. That means R with the R starts, rubber items, plastic items, tube items. So you can see all those rubber, plastic, tube items, glove, they always ask. Urine bag, they always ask. Syringes, they always ask. Actually, whatever is there in yellow and red, they always ask. White means transparent. So naturally, you are putting sharp items in that. In blue, you are putting broken glasses and metallic pieces. Broken glasses and metallic pieces. And they ask this question, pacemaker, where do you put pacemaker? Okay. Then viral transport medium. Viral transport, VTM, viral transport medium. That was the previous year exam question. Whenever you hear viral transport medium, automatically you tend to think, it is coming under microbiology, biotechnology, so it has to go into yellow. No. Viral transport medium, it is coming in plastic tube. Right now, I don't have the picture, but it's there in the class. And I said, there's a plastic bottle. So it goes to VTM. Viral transport medium is going to red. So that finishes the MCQs from this particular topic. Moving further. Most comprehensive indicator of cost-effective analysis. Don't you know? CBA, CA. Ma'am, pneumoconiosis symptoms will be like pneumonia. Not exactly like pneumonia. The patient will be having cough. First, it will start like, respiratory tract problems. Like, patient will be having cough. Patient will be having, heaviness of chest. Sometimes, restriction of chest, all those things. But later, the patient may develop pneumonia. Sometimes the patient will go for fibrosis. So the symptoms will change accordingly. That depends upon what is the stage. Okay. Need not be pneumonia all the time. Okay. Pneumonia is also possible is what I am saying. Okay. What is the answer here? CBA, CA, cost effective and cost benefit analysis. The answer is QALY. Yes. Yes. Okay. This is the MCQ. We have two, which is CBA, cost benefit analysis, cost effective analysis, CBA, CA, right? In both, what you are actually trying to, by the way, guys, do you know this this topic is from the chapter planning and management. So in this particular chapter, we are trying to see how good are you in utilizing the scarce resources for getting maximum output. That means in our medical field, we know that we are getting a lot of diseases. So we need resources and the resources are always less. So before using the resource, you have to make sure that you are doing good planning and you are using all the available resource to get maximum output, right? So it is a comparison between input and output. Okay. So whatever you invest is an input, then you have an output. Okay. And in cost benefit analysis and cost effective analysis, you are comparing this input and output. Okay. Are you able to see input output like a weighing machine? Okay. Now, in cost benefit analysis, cost effective analysis, the input is always in terms of money. That is why it is starting with cost. And you can very well see input is in terms of money. That is the first MCQ. In both CBA and CEA, the input is in terms of money. Second MCQ is regarding the output. If output is also in terms of money, it is cost benefit analysis. If output is in terms of number of results achieved, like number of lives saved, number of diseases prevented, number of hospitalization prevented, then it is cost effective analysis. Okay. Okay. There is nothing to mug up. Guys, you're all normal people. Majority of normal people. Benefit means money, right? Right. You will agree with me that with majority, money is benefit or benefit is money. If I do that, what is going to be my benefit, right? So you are indirectly asking about how much money you will get. So I hope you are able to follow the tips that I'm trying to give. Money means benefit. Benefit means money. Whereas effectiveness, how do you assess the effectiveness of a vaccine? Number of diseases prevented, right? Number of hospitalization prevented. So effectiveness is in terms of number of results achieved. Okay. And the MCQ here was, which is the most comprehensive indicator of cost-effective analysis? It is QALY. Okay. Now, what is QALY? QALY is quality adjusted life year. Quality adjusted life years, which we have discussed in class. No time to discuss it any further. Okay, so there you are also measuring the quality of how much years of quality life that you have added by your medical intervention. Okay, that is in terms of number of results achieved, not in terms of money. Okay, moving further. What did you write here? A patient comes to you with a single hypopigmented hypoaesthetic plaque with thickened nerve. What is the current management protocol for this patient? Purposefully, I asked current. I would like to hear from you. What did you write? What did you write? Deshan. What did you guys write? Because this question, wherever I ask this question, whenever I ask this question, I get, 50% correct, 50% wrong. Yes. The answer is, sorry, the answer is A. A for 6 months, right? So let's see why it is A. Okay, I said current treatment regimen. See, there are actually we have two regimens. One is according to the Indian and the other is according to WHO. This is the WHO classification. Oh, sorry, where is it? Don't you guys know that when it comes to the leprosy treatment, we have paucibacillary and multibacillary, right? Paucibacillary means, as per the current guideline, and you also know that depends upon three things. One is skin lesion, nerve involvement, and presence of bacilli in slit skin smear, right? So based on that, you have pauci and multi. And actually, one slide I'm trying to show you, but I can't see that slide here. It is missing. Anyway, I'll just tell you, these are the cardinal features. If at least one of this is present, you call the patient as a case of leprosy. Moreover, what you see here is again an image-based question. If you see the tip of the finger in the form of a house, can you see? And you see, can you see detached fingers? And then one lotus. This is the logo of NLEP, National Leprosy Eradication Program. Okay, that is again another MCQ. Now, previous guideline, as per the previous guideline, not previous, I would say the latest guideline, we have WHO guideline and Indian guideline. According to Indian guideline, see, POSI means 1 to 5. At least 0 to 1 nerve thickening. That means no nerve thickening or 1 nerve thickening. And if you don't find any bacilli in the slit skin smear, it is POSI. Right? This is the latest, or not latest, the current. I'm saying the current, which is running in 2024. So it's a case of POSI is someone who has got 1 to 5 skin lesions, no or 1 nerve involvement, and there is no bacilli in slit skin examination. And for POSI in India, what we are currently having is a green. Can you see the green MDT kit? Okay. Actually, I had a better picture, but somehow it is missing. This green, which has got 2 medicines. Which are those 2 medicines? You have rifampicin and dapsone. Can you see? Rifampicin and dapsone. This is the current treatment guideline. Okay. I'm not going to the treatment guideline. And this is given for 6 months. This is the latest. Sorry, the current one. Okay, current one. And for multibacillary, if the number of skin lesions are more than 5, if more than 1 nerve is involved, and if the microscopy shows presence of bacilli, that becomes multi. And for multi, as of now, we are giving 3 drugs for 12 months. Okay, 3 drugs for 12 months, which is B. It has got 3 drugs. So the color of paucibacillary kit is green and multibacillary kit is red. I hope it is clear. So this is the current regimen. So A is given for 6 months is the answer. Now, any update? I've given that update in Insta. If you are following, you might be knowing that. As per the latest update, even now, what I have said is what is running till 2024 end. But this is the latest guideline by Government of India. They have said that from April 2025, that means in coming future, April 2025, there will be a change in the guideline. Okay. So what is going to come next year is something different. See, POSI, it is 1 to 5. No nerve involvement. That means if at least 1 nerve is involved, that will automatically go to multibacillary. Is that clear? This will come into existence only from April 2025. So my question was current. Okay. And if bacilli is present, like before, it will be in multi. Okay. So 1 nerve involvement as per the current guideline is POSI. Whereas from April 2025, it will be multi. Okay. And treatment regimen is also different. From April 2025, they say for both POSI and multi. Please remember, for both POSI and multi, it will be 3-drug regimen. Then what is the difference? 3-drug regimen will be given for 6 months in POSI and 3-drug regimen will be given for 12 months in multi. So this will come into existence only from April 2025. So please keep that in your mind. Okay. So I'm giving you the latest guideline, which will be implemented in future, whereas the current guideline. I hope it is okay. Okay. Which is the following variable is an example for nominal? What is the answer? You know about, okay, guys, we have qualitative, quantitative variable. Shall I continue? Okay. So we have qualitative and quantitative variable. If you are feeling hungry, sometimes statistics may not get into your brain. Okay. So just listen to this. See, qualitative and quantitative. Qualitative is divided into nominal, ordinal, binomial. Okay. Nominal means there will be a name. Ordinal means there will be an order. Bi means only two outcomes will be possible in that particular thing. Okay. Under quantitative, we have mainly, things which can be written in numbers. That is quantifiable, quantitative, quantifiable. So things which can be written in numbers like, age, height, weight, all these are coming. Okay. So height is quantitative, right? Ethnic group. How do you write ethnic group? As names, right? Social class as order. Age categorized as young, middle, old. Again, there is an order. Now you tell me, this is quantitative. This is, I said, names are there. So ethnic group. The question is, which is nominal? It is ethnic group. Is that clear? So here the answer is ethnic group. Okay. Moving further. See, correct, Anuj, correct. I'll try to stop in another 5 minutes. So please, please, let's rush. What is the answer? This is new. I know you know the answer. So shall I give you the answer? We know this happened recently in October. Yeah, in October. Now it is, earlier it was 500 rupee per month. Now it is 1000 rupee per month, right? Don't you know that? It is 1000 rupee per month. And there are a few more other updates. In 7th October 2024, this came just in this month. So what does that say? Can you see 3 points? So all these three you can expect as an MCQ. Now they have increased. Let me just increase the font. Are you able to see now? I've copy pasted the government guideline. So, so that you will not miss even a single term. Now the government has enhanced Nikshay Poshan Yojana. Nikshay Poshan Yojana means it is for TB patients, right? Nikshay Shaya means TB. So this is for TB patients. And Poshan means food. So this is for the nutritional support of patients. Earlier, till recently, government was giving how much? 500. Okay. And now it is 1000 per patient. Okay. Then there will be energy dense nutritional supplements for all the underweight patients with BMI less than 18.5. Along with that, they will be giving food. Okay. Earlier, they were giving only money for food. Now, they have increased that money. Moreover, for those who are underweight, for them, energy dense nutrition supplementation will also be given for the first 2 months of their treatment. Then, there will be a coverage for family members. That means household contacts of TB patients under Nikshay Mitra initiative of Pradhan Mantri TB Mukt Bharat Abhiyan. Okay, so keep that in your mind. Any other thing which happened in, I didn't ask you a question, but along with this, there was one more update which came in October 2024. Have we taken any other disease out? I wanted to ask you a question in this, but later I thought, okay, I'll give you another. I will give this as an update so that I can add some other question. So that covers many topics, right? See, in 2024, we have one more achievement. What is it? We have eliminated trachoma. So every newer thing you can expect as MCQ. Moving further, Who said there were less questions? There were no questions from statistics. See, this is one question. True statement about non-parametric tests include all except. The question is about test of significance. Okay. Guys, we have two different types of test of significance. Okay. First, I will explain and then you can tell me what is the answer. By the way, Popchi, nice name. And your answer is correct. Funny names you guys put. So, okay. So, the question is about test of significance. So, we have two types of test of significance. You know, chi-square, t-test, ANOVA, paired T, students T. All these are various tests of significance. They are again divided into two. You have parametric test and non-parametric test. Okay, how to do test of significance, how to, pick it. It is there in YouTube. You can see. I mean, I myself have put a video, so that will be available. And sorry. Okay. Now, parametric test, the MCQs, it can only be applied in a normal distribution. Parametric can be applied only in a normal distribution. That is the first MCQ. Whereas non can be applied in any distribution. Any distribution, whether normal or abnormal or skewed, whatever, you can always use non-parametric. Okay, that means it do not discriminate anyone. Okay, with broad heart. Next, parametric can be used only in large samples. Usually, I would say in large samples. Whereas non-parametric, I said broad heart. So whether small or big, doesn't matter. It can be applied in any distribution, any sample size. Whether small or big, doesn't matter. Okay, and in any type of variable. So for any, it is non-parametric. Okay, whereas for normal, it is, or parametric is only for normal, and for normal, the best is parametric. Okay, because non-parametric is not that good. Next MCQ is, which are the examples for parametric? Okay, so from here, I am taking the examples. Remember this mnemonic, T, A, P, tap, tap is the parametric test. But T, which one you know? Guys, we have only one T test. A, ANOVA, and P is Pearson's. Just remember, we have various Pearson's tests. Okay, Pearson's correlation coefficient. So we have some Pearson's tests. So remember TAM. And the rest, everything, whatever comes your way, you put it under non-parametric, including your chi-square test. You know, your chi-square test is also a non-parametric test. Okay. So that is the answer. These are the explanations. So using this explanation, you can tell me true about non-parametric tests are all except. Except means they can be used in small. Yes, that is true, right? This is true. The question is which is false. They can be used to analyze samples that are normally normal, abnormal, no problem. They can be applied to ordinal data. Okay, there is no C here. Just now I realized there is no C. I don't know how the question came. In question, maybe it was C. So ordinal, that is also true. They cannot be used if the nature of distribution is unknown. No, I said, whether you know or don't, you can always use non-parametric. So this is false. So the answer is this one. Okay, this is the answer. Moving on to the last question. Last. And I hope you guys have sat through the whole presentation. A patient was admitted to a government hospital with an microscopically confirmed Plasmodium falciparum infection. Which one of the following treatment is indicated? So this is the last question. No time. I'm going to the answer. It is D. Artesunate sulfadoxypyrimethamine. So the question is about Plasmodium falciparum, right? So let's see the treatment. Don't you guys know that in India we have Plasmodium vivax and Plasmodium falciparum, right? For Plasmodium vivax, the drug of choice is mainly chloroquine, primaquine. It is given for 3 days. Chloroquine as 10 mg per kg on day 1, same 10 mg per kg on day 2, and half of that 5 mg per kg on day 3. And chloroquine is given as 0.25 mg per kg for 14 days. Now, why is it given for 40 days? It's another MCQ. For how long you give this? That is an MCQ. The dose, that's an MCQ. And why is also an MCQ. Why? You tell me why. Because to prevent relapse. To prevent relapse. We know that Plasmodium vivax means relapse is possible. Whereas Plasmodium falciparum, the drug of choice is ACT. Have you heard about ACT, guys? ACT means artemisinin combination or artemisinin combination therapy. Okay, ACT. Artemisinin is given for 3 days as you like chloroquine. Okay, it is given as 4 mg per kg for 3 days. And sulfadoxine pyrimethamine combination is given for just 1 day. And the dose is sulfadoxine 25 mg per kg and pyrimethamine 1.25 mg per kg on day 1. So this is your ACT kit. That is artemisinin combination. Okay. So this is the combination. What about primaquine? There is no relapse, so there is no need to give it for 14 days. So you're just giving one single dose, but 3 times more higher concentration. That is 0.75 mg per kg for day 1, day 2, day 3. Just one, right? There are 3 days of treatment. When will you give? On day 2. So this was the answer. Okay, this was the answer. And in northeastern states, you're giving artemether lumefantrine, right? Not ACTSC, but artemether lumefantrine. And to stop with the last slide, in combined infection, combined means the patient has PF plus PV. So you have to treat both. PF is, for PF, you are giving artemisinin. ACT, right? That means artesunate, sulfadoxine, pyrimethamine. And what is the problem with PV? PV has relapse. So you have to prevent relapse as well. For preventing relapse, you have to give primaquine 0.25 mg per kg for. Okay, so primaquine is given for 14 days, 0.25 mg per kg for 14 days. Okay, so I hope it was your, this discussion was useful. I've gone through almost every important topics, but you guys don't stop with this. Okay, you have to read as much as possible, but these are very, very high yielding topics, which I have handpicked for your exam. And that's why I was discussing everything. It took around 1.5 hours, but I'm so happy that you all sat through. And what is it, Narayan? JEE is killed. Okay, the recent update, JEE is killed vaccine. Okay, what we have now is killed. But honestly, we have both. But the recent update says that it is JEE vaccine. Now it is killed vaccine. Okay, it is killed vaccine. And it is not given subcutaneously like earlier. Now it is given as intramuscular. Third MCQ from JEE. Earlier we said it can be given up to 15 or sometimes 5. Now they have reduced it to, it can be given only up to 2 years. And the fourth update from JEE is it follows open vial policy. There are, thanks Narayan that you have raised this doubt so that I could give you 4 other updates. Open vial policy, it follows open vial policy. Okay, I've given this in Insta. And ma'am, any advice for last day before exam? Come on, you guys are very good. No need to get tensed. Okay, just go and crack the exam. What, yeah, it's just an exam, right? You have already prepared and just go and give your best. That's it. Okay, no advice, nothing, because you guys are always very good. And if you want if you have any further queries, and if you want anything from, any update or whatever, it will be available in Instagram. Plus, I'm once again giving you my WhatsApp number. Those who are already in touch with me know that I will definitely get back to you whenever you have any doubt. And there is a WhatsApp group for NEET INI CET. Uh, Currently, I don't have that I forgot to bring that WhatsApp link. But if you're interested, just WhatsApp me. I'll give you the link. Okay. I hope it was useful. Oh, thank you, Aditi. Thank you. PUBG, you're still okay. Okay. Uh, thank you very much, Mr. PUBG. It will be useful for you FMG as well. Nowadays, everything is, the topic, everything is the same. Even the standard of FMG is also increasing. So this will help you for sure. And what else? Okay, bye. Bye, guys. Bye bye. Bye bye. Good night. All the best. All the best. All the best for the exam and my prayers. So stay cool, stay calm, just stay confident, give your exam. Okay? Love you all. Bye. Recording stopped.